Well, hello everyone. Welcome back to another women's health diagnosis webinar. And we are into part 6 of the series. And we're going to be talking about a fairly common and potentially serious condition that affects about 15% of new mothers out there. And it is postpartum depression. And I am Zoom Heaton, and I am the Women's Health Clinical Liaison. So let's dive in. We're going to be discussing the definition and incidence of postpartum depression, the etiology, the risk factors, the signs and symptoms, diagnosis and screening, the impact of postpartum depression, and treatment. So just a little bit of history of depression. The earliest written accounts of what is now known as depression appeared in the second millennium BCE in Mesopotamia. And in these writings, depression was discussed as a spiritual rather than a physical condition. And like other mental illnesses, it was believed to be caused by demonic possession. And as such, it was dealt with by priests rather than physicians. Hippocrates in the 4th century, who was a Greek physician, suggested that depression, which was initially called melancholia, was caused by 4 imbalanced body fluids called humors: yellow bile, black bile, phlegm, and blood. And specifically, he thought that melancholia was caused by too much black bile in the spleen. Hippocrates' treatments of choice included bloodletting, baths, exercise, and diet. And during the beginning of the Age of Enlightenment in the 18th and early 19th centuries, it was thought that depression was an inherited, unchangeable weakness of temperament, which led to the common thought that affected people should be shunned or locked up. And as a result, most people with mental illnesses became homeless and poor, and some were committed to institutions. So let's define postpartum depression. It is typically defined as the presence of depressive symptoms occurring up to 12 months after birth, and it is also known as postpartum major depression. 50 to 80% of women experience transient baby blues within the first 2 weeks following delivery. And the baby blues may last only a few hours or as long as 1 to 2 weeks after delivery. And usually you don't need treatment from a healthcare provider for baby blues. But postpartum depression can occur a few days or even months after childbirth. And it can happen after the birth of any child, not just the first child. The symptoms are very similar to the baby blues, but they're much more pronounced. It could be very debilitating, keeping one from doing the things that they need to do every day. Now, let's look at the incidence of postpartum depression. It is reported that 1 in 7 women will get a perinatal mood or anxiety disorder, like postpartum depression or anxiety shortly before or any time after childbirth. And it commonly begins between a week and a month after delivery. And about 50 to 80% of women experience transient baby blues within the first 2 weeks following delivery. And these new moms may feel depressed, anxious, or even angry a few days after giving birth, but they are just the baby blues, and they're generally normal, and they usually go away within a week or so without treatment. The incidence of depression among women peaks between 18 to 44 years of age, and 0.1% to 0.2% of women experience postpartum psychosis, usually within the first 4 weeks following delivery. And postpartum psychosis is the severest form of mental illness in this category, which I'll discuss later in the presentation. And nearly 60% of women who experience postpartum depression don't officially get a diagnosis, and around half don't get treatment. So most cases are missed or underreported. So what causes postpartum depression? No one knows what triggers postpartum depression. It probably does not have a single cause. It likely results from a combination of physical and emotional factors. And it's important to know, though, that postpartum depression does not occur because of something a mother does or does not do. And the cause could be multifactorial, including hormone levels quickly dropping after giving birth. According to the National Institute of Mental Health, After childbirth, the levels of hormones like estrogen and progesterone in a woman's body quickly drop, and this leads to chemical changes in her brain that may trigger mood swings. And it's interesting to note that levels of estrogen and progesterone increase tenfold during pregnancy, but drop sharply after delivery. And by 3 days postpartum, levels of these hormones drop back to pre-pregnancy levels. There's more research that's needed to determine the link between the rapid drop in hormones after delivery and depression. Also, many new moms find it difficult to get the rest they need after giving birth. Sleep deprivation can lead to body pain and exhaustion, which may also contribute to the symptoms of postpartum depression. So there are many changes, such as chemical changes, social and psychological changes, that play into postpartum depression. Other factors that can contribute to postpartum depression include physical changes to a woman's body, worrying about parenting, and changes to her relationships with her partner. These many changes, such as chemical, social, and psychological changes, are associated with having a baby that increases a woman's risk of postpartum depression. So, because postpartum depression presents different signs and symptoms that can change throughout the course of the disorder, these symptoms are numerous and broad, and it can be difficult at first to achieve a diagnosis. And there's no single diagnostic tool or test that physicians use to reach a postpartum depression diagnosis or a diagnosis of any other type of postpartum mood disorder. An accurate diagnosis of postpartum depression involves three things: clinical assessment, which is a thorough medical and psychiatric history, which is vital; screening tools, instruments like the Edinburgh Postnatal Depression Scale, or EPDS, can really help in identifying PPD, which we'll discuss shortly. Differential diagnosis: it's important to ensure that these symptoms are not due to thyroid dysfunction, anemia, or other medical conditions. Because the symptoms of postpartum depression are so broad, it is critical to ensure that symptoms like depression, irritability, anxiety, and fatigue are not a result of thyroid dysfunction. Since after childbirth, many women develop an underactive thyroid condition called postpartum thyroiditis. And this condition causes similar symptoms to postpartum depression and includes anxiety, fatigue, irritability, and the inability to concentrate. So many physicians and patients work with a mental health care professional like a psychiatrist or psychologist to further conclude a diagnosis and pursue treatment options. If a patient's symptoms align with the known symptoms of postpartum depression, a mental health professional can use another diagnostic tool. And this tool is the fifth edition of the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, which is published by the American Psychiatric Association. The DSM-5 is a mental health disorder classification and diagnostic tool. It helps to provide an official postpartum depression psychiatric diagnosis by allowing the patient to understand their condition more fully. Once a postpartum depression diagnosis is reached using the DSM-5, insurance providers will reimburse families for their medical expenses. And up next, we're going to look at the importance of screening and the tools used to assess the recent symptoms and behaviors to ensure that there is a correlation between the symptoms and childbirth. And if the questionnaire or the screening test results are congruent with the known signs and symptoms of postpartum depression, then a diagnosis can be reached at this stage. And with a diagnosis, a treatment plan can be implemented. So why is screening so important? First and foremost, postpartum depression screening helps identify a set of initial depression symptoms in new moms. Many women are unable to recognize that she is depressed, and she may believe her symptoms are normal for a new mom. So it does help to diagnose the condition so it can be treated early. It helps to better understand the extent of her symptoms. For example, a postpartum depression screening test could help her doctor predict if her initial symptoms are likely the milder baby blues or if they will potentially develop into full clinical postpartum depression at some point. And also to identify rare condition of postpartum psychosis. And this is in extremely rare cases. This type of postpartum depression called postpartum psychosis develops. And it is the severest form of mental illness in this category that is characterized by extreme confusion, loss of touch with reality, paranoia, delusions, disorganized thought process, and hallucinations. It affects around 1 to 2 per 1,000 females of childbearing age and usually happens immediately within days to the first 6 weeks after birth. Even though it's rare, it is considered a psychiatric emergency that warrants immediate medical and psychiatric attention and hospitalization if the risk of suicide or filicide exists. So, postpartum depression presents different signs and symptoms that may change throughout the course of the disorder. And because the symptoms are numerous and broad, it can be difficult at first to achieve a diagnosis. So there's no single diagnostic tool or test that physicians use to reach a postpartum depression diagnosis or a diagnosis of any other type of postpartum mood disorder. And there are several tools, which include the Edinburgh Postnatal Depression Scale, the PHQ-9, the Mills Depression and Anxiety Checklist, the Center for Epidemiological Studies Depression Scale, or the CESD. But the Postpartum Support International, or the PSI, recommends universal screening for the presence of prenatal or postpartum mood and anxiety disorders. Using an evidence-based tool like the Edinburgh Postnatal Depression Screen or the Patient Health Questionnaire. And both the EPDS and the PHQ-9 are validated for use in the perinatal population, and there is no fee. The benefits are that they are self-administered, translated into many languages, and they're easy to complete. The EPDS addresses the anxiety component of PMAD, or perinatal mood and anxiety disorder, as well as depressed symptoms and suicidal thoughts. The PHQ-9 does not have the anxiety component, but includes suicidal ideation. The PHQ-9 also incorporates the categories that define depression in the Diagnostic and Statistical Manual, which helps with diagnostic criteria. And with anxiety being recognized as one of the presenting symptoms of PMADs, it becomes important that it be assessed in the screening tool, making the EPDS the most widely used tool. So the Edinburgh Postnatal Depression Scale was developed in 1987 in Scottish medical centers to identify depression in women who had just given birth. And the EPDS is a structured 10-question screen. It was created by a team of 3 researchers who saw a gap in the ability of current depression scales to assess unique symptoms of depression after giving birth. And to help improve accurate postnatal depression evaluations, the team developed the EPDS, a 10-question self-administered assessment. And then they conducted a validation study to prove its effectiveness. And since that time, the EPDS has become one of the most commonly used postnatal depression screening tests around the world. It is sensitive, but it is not specific. It identifies almost all women who may be depressed, but also identifies other women who are not depressed. So there are some false positives, and it can be scored and forwarded to a physician for further review based on the score. So the Edinburgh Postnatal Depression Scale is designed for home and outpatient use. It consists of 10 questions. It can be completed in 5 minutes. It reviews feelings from the previous 7 days and it is scored 0 to 3 depending on the symptom of severity. Each answer on the EPDS has a value of 0 to 3. And once you've completed all 10 questions, the answers are scored and tallied into a final count. And traditionally, scoring above 9 suggests a chance of postnatal depression. But the EPDS creators note that the questionnaire can't offer a definitive diagnosis. It's also possible to score high on the assessment if you're living with a condition such as post-traumatic stress disorder or any anxiety disorder, for example. And here is an example of what the Edinburgh Postnatal Depression Scale screening form looks like. So here's a chart interpreting the scores. So if their score is 9 or less, then pretty much indicates that there's no depression. And then it just itemizes depending on the degree of concern, whether it's 10 to 12 or 13 to 18, and anything 19 and above, patient is likely to have depression and have potentially suicide risk. And just a note on the EPDS screening, its accuracy and limitations. According to a 2020 review of the EPDS, using a final score of 11 or higher as the marker for postnatal depression gives the EPDS a sensitive rating of 81% and a specificity rating of 88%. So that suggests that 81% of people living with postnatal depression will test positive on the EPDS, and 88% of people not living with postnatal depression will test negative. And it also means approximately 19% of people who live with postnatal depression may falsely test negative, and 12% of people not living with postnatal depression may falsely test positive. So aside from the chance for an inaccurate result, the EPDS is a screening tool only and can't provide a definitive diagnosis. But the test also doesn't cover all symptoms possible in postnatal depression. Emotional distancing from the infant, for example, or thoughts of harming the infant aren't covered on the questionnaire. Some risk factors include hormonal factors. Although levels of estrogen, progesterone, and cortisol fall dramatically within 48 hours after delivery, women with postpartum depression do not differ significantly from non-depressed women with regard to levels of estrogen, progesterone, prolactin, and cortisol, or in the degree to which these hormone levels change. However, affected individuals may be abnormally sensitive to changes in the hormonal milieu and may develop depressive symptoms when treated with exogenous estrogen or progesterone. Women with a previous history of depression, a family history of a mood disorder, or depression during the current pregnancy are at increased risk for postpartum depression. A meta-analysis by Zacher Kielsen et al. Found that women who have family history of any psychiatric disorder have almost 2 times the risk of postpartum depression as do women without such a history. And furthermore, women with a previous history of postpartum depression or psychosis have a risk of recurrence of up to 90%. A stressful life event during pregnancy or shortly after giving birth, like a job loss or death of a loved one, domestic violence or personal illness, or medical complications during childbirth, like premature delivery or having a baby with medical problems. And other risk factors of postpartum include mixed feelings about the pregnancy, whether it was planned or unplanned, a lack of strong emotional support from a partner, spouse, family, or friends, and any sort of substance abuse or alcohol problems. So what are the signs and symptoms of postpartum? Well, the symptoms range from mild dysphoria to psychotic depression to suicidal ideation. A lot of these symptoms don't last for just a few days. Half of the women are symptomatic for 6 months, and about a third of the women continued to be symptomatic at 12 months, especially if untreated. There's feelings of hopelessness, helplessness, low self-esteem, mood changes, irritability, persistent sadness, and other signs and symptoms include loss of pleasure in activities, inability to rest when the baby is resting, feeling overwhelmed easily compared to past coping, anger, resentment, thoughts of doing harm to the baby, unexplained changes in sleep, or appetite. Sometimes people will have a tendency to eat too much, and other times they'll go for a couple days without eating, and sometimes they'll just sleep all the time, or they just can't get to sleep at all. Inability to focus or concentrate, an inability to adjust to the role of motherhood. So, the impact of postpartum depression can be serious. A 2019 research review found that compared with mothers who felt fine after childbirth, those with postpartum had lower self esteem, more anxiety and depression, more relationship problems, more risky behaviors like smoking. And untreated postpartum depression can increase the risk for suicide. And suicide is a leading cause of postpartum death, accounting for 1 in 5 maternal deaths in the first year after childbirth. A mother's mental health can affect the child's health too. Moms with postpartum depression don't breastfeed for as long as those who don't experience postpartum depression. Moms with postpartum depression don't breastfeed for as long as those who don't experience postpartum depression. And they also have more trouble bonding with their newborns and are at greater risk of neglecting or abusing their babies. Additionally, babies of mothers with postpartum depression have more behavior problems, experience language delays, have more trouble sleeping. They could have cognitive and psychological development issues. They have delayed motor skills. They are fussier and they vocalize less. The effects postpartum depression may have on a child can last for many years. A 2020 study found that children who were exposed to their mother's depression had more emotional problems and more difficulty with social skills when they started school, especially if the exposure happened in their first year of life. Postpartum depression can also strain a relationship between partners, as the mother's emotional state and behavior can be difficult to understand and cope with. Partners may feel neglected, frustrated, or helpless in trying to support their loved ones. Also, the impact of postpartum can affect a partner's mental health, leading to symptoms of depression, anxiety, or stress. And other family members may also feel helpless and frustrated and worried about the affected mother, potentially leading to tension and conflict within the family unit. Postpartum depression takes a toll on parenthood as well as the marriage. Studies show that women who have postpartum depression are more likely to divorce or separate, and that's because a couple often struggles to communicate. And women with postpartum depression may lash out at their husbands, causing them to feel defensive. Communication is a huge issue, and the woman has anxiety or depression, and the man may feel helpless or frustrated. In fact, communication struggles often lead to divorce, and this is especially true right after giving birth. Statistics show that the first year after becoming parents is the most challenging for married couples, and postpartum depression contributes to this. Postpartum depression sometimes goes away on its own within 3 months of giving birth. But if it interferes with one's everyday life at any time, or if the blues last longer than 2 weeks, then it might be prudent to seek treatment. And the first step in treatment is to resolve immediate problems like sleep and appetite changes. And sometimes antidepressants are necessary. And this would be a situation where the patient would be making this decision with her doctor on the type of antidepressant that is best for her based on her symptoms and whether or not she's nursing. And some common antidepressants that are used are your selective serotonin reuptake inhibitors like Zoloft and Prozac, your serotonin and norepinephrine reuptake inhibitors like Cymbalta and Pristiq. You have Wellbutrin and your tricyclic antidepressants like Elavil and Tofranil. And of course, the issue would be the caution with breastfeeding, but most of these antidepressants are very safe. Brexanolone or Zulresso is the first drug approved by the U.S. Food and Drug Administration specifically for postpartum depression in adult women. It slows the rapid drop of certain hormones after childbirth that may lead to postpartum depression and the potential serious side effects of excessive sedation and sudden loss of consciousness, the requirement that the patient has to stay in a healthcare facility with monitoring by a healthcare provider while receiving the medication through an IV infusion over 60 hours or 2.5 days. All of this is the reason why the treatment is not yet widely available. Research continues on an oral medication for postpartum depression with promising results. The medication being studied works in a way that is similar to brexanolone, but it could be taken daily as a pill and may not have the same serious side effects. So, other treatment includes psychotherapy or talk therapy, which is commonly prescribed alone or with antidepressants to treat postpartum depression. And usually, this is a referral from the physician to a qualified mental health professional who specializes in treating postpartum depression. And this is where the patient will meet with the counselor on a regular basis to talk. And the counselor teaches them how to look at things differently, how to change certain habits to help them to feel better. And there are two common types of therapy for women with postpartum depression. You've got the cognitive behavioral therapy, and that's a psychosocial intervention that focuses on personal coping strategies to improve mental health. It's been shown to reduce both anxiety and depressive symptoms in postpartum women. This is where the patient and the counselor can work together to identify, then change thoughts and behaviors that are harmful to their mental health. And then there are interpersonal therapy, and this is where the therapist can help the patient to better understand how they behave in their relationships and how to work through problems. And of course, support groups are very helpful in postpartum. They can provide useful information and ideas about how to handle day-to-day stressors. Sometimes prescription medications are not warranted, and alternative or complementary therapies may be a better option. Research shows that exercise has a strong antidepressant action. Even pram walking or stroller walking has been shown to exert beneficial effects. Yoga, in one study of depressed new moms, more than 3/4 of them who did yoga twice a week for 8 weeks got better. Massage, it may have a positive effect on postpartum depression, although more studies are needed. Findings suggest that massage helps improve symptoms. Relaxation training techniques like deep breathing, guided imagery, and self-hypnosis can teach one to soothe themselves. And more than a dozen studies have shown that relaxation training can help a person recover from depression. Meditation, learning to meditate, lets a person to exist in the moment. And the focus on the breathing lets go of the person's thoughts, and it might help with their depression. Somatic therapy is a holistic approach to healing that recognizes the deep connection between mind and body. It involves working with a therapist to explore the physical sensations, emotions, and bodily experiences that are connected to psychological distress. And through techniques like breath work, movement, and mindfulness, somatic therapy aims to release stored tension and trauma, promoting a sense of well-being and balance. And for new mothers experiencing postpartum depression, this can be a powerful way to regain a sense of control and agency over their own well-being. There are nutritional supplements that may be very helpful in postpartum depression, and we're going to go over a few of those. Let's start with omega-3 fatty acids. High doses of omega-3 liquid from fish oil has been shown to reduce depression through lowering neuroinflammation and can be especially beneficial in the perinatal period So, high doses of omega-3 liquid from fish oil has been shown to reduce depression through lowering neuroinflammation and can be especially beneficial in the perinatal period. It's also one of the most important nutrients for the baby's brain development, and the recommended dose should contain 2 grams of EPA per day, and it takes about 3 to 4 weeks to exert its effects. It's recommended to take before birth to build up stores and to assist in brain development in the infant. And it's important to take a highly purified fish oil, which is tested for heavy metal contamination. Your B complex, B vitamins are essential for healthy stress response and neurotransmitter balance. It's recommended to take a vitamin B complex as they will work synergistically with each other to achieve better results. Vitamin D is especially important as depression has been linked to low vitamin D levels. This is especially significant during the winter months when sunlight exposure is particularly low. It's also one of the nutrients recommended by the Ministry of Health for healthy development newborn babies. And the adult recommended doses range from 1,000 international units a day or more, depending on the level of vitamin D in the blood. So it is good to have vitamin D levels tested. Another important yet unknown nutrient for mothers and babies is inositol. It is the third most abundant carbohydrate found in breast milk, and it's been shown to be a vital component for the baby's brain development. It's also been shown to be very effective for reducing anxiety, panic disorders, and obsessive compulsive disorders. And it needs to be taken in high doses, 12 grams to 18 grams a day, and powders are recommended. Magnesium has been shown to significantly decrease symptoms of anxiety, and it supports mood. It also improves quality of sleep. Recommended doses are 300 milligrams of elemental magnesium once or twice a day. Some herbal supplements that may be helpful. Saffron is known to be the world's most expensive spice due to the labor intensiveness of its production. And saffron's use as a medicinal herb has been documented for over 4,000 years. In December 2017, the journal Phytomedicine published the results of a clinical trial on saffron stigma for treating mothers suffering from postpartum depression. The results showed that the group treated with 15 milligrams twice daily of saffron stigma showed a 96% remission rate for postpartum depression, twice that of the placebo group. So they concluded that it was safe and a significant treatment for mothers suffering from postpartum depression. Turmeric, curcuminoids derived from turmeric have shown significant benefits for treating depression and anxiety. In a 6-week study, 50 individuals diagnosed with depression were randomized to receive 20 milligrams a day of fluoxetine or Prozac and 25 milligrams per day of turmeric individually or in combination. The mean change in scores and remission rates were similar across all 3 groups, suggesting that turmeric has an equal effect to fluoxetine for the management of depression, and it's been shown to be safe in breastfeeding. Use in late-term pregnancy is not advised due to its blood-thinning effects and theoretical risk of early labor. And there are certain strains of probiotics like lactobacillus and bifidobacterium have been shown to exert a positive effect on depression, stress, and anxiety. It is especially relevant in those who experience stress-related IBS symptoms. So what's the prognosis of postpartum depression? Early recognition and treatment of postpartum depression can lead to better symptom management and faster recovery rates. And that is with all forms of mental illness. Without treatment, postpartum depression can last for months or even years, but effective treatment is available that can help women manage their symptoms and improve their quality of life. Of those with postpartum depression who were not receiving clinical treatment, 30% still had symptoms of depression up to 3 years after giving birth. 80% of women with postpartum depression will achieve a full recovery. So what are the key takeaways? Postpartum depression is a complex mix of physical, emotional, and behavioral changes that happen in some women after giving birth. It is a form of major depression that begins within 4 weeks after delivery. Postpartum depression is linked to chemical, social, and psychological changes that happen when having a baby. It is relatively common, it is easily missed, and that is why screening is important. The symptoms of postpartum depression can be hard to detect, and with postpartum depression, these come along with other symptoms of major depression which aren't typical after childbirth. There's no one cause of postpartum depression. It may have long-term consequences for the mother, infant, and family, but it can be managed and treated. Here are your references, more references. Connect with us. We are a national network of 503A and 503B compounding pharmacies, providing innovative and quality pharmacy preparations and services through industry best patient care and solutions for customers and practitioners. We're dedicated to delivering innovative and top-notch pharmacy preparations and services, all backed by a commitment to industry-best patient care. Our mission revolves around providing comprehensive solutions for customers, ensuring they receive the highest quality healthcare. So tap into our top-notch clinical team and resources with our combined over 50 years of experience and expertise in compounding, women and men's health, IV nutrition, functional medicine, and so much more. Let us help you to help your patients receive the best quality clinical and compounding care possible. Thank you for tuning in today, and I hope that this was informative and helpful, and we will have more diagnostic webinars to come, and see you next time.